Okay, good morning, everyone, and welcome to this webinar. I'm delighted to be launching the report, The Mental Health of Harm Reduction Staff, as part of the monitoring for 2023 as correlations monitoring for 2023. Maybe just a little bit of housekeeping. So I'm going to go through the findings of the report, and then we will go to a panel discussion. I'll introduce the panelists, and then we'll have a Q&A session with them. Just to ask you to use the Q&A function at the bottom of the screen to ask any questions. If you'd like to use the chat, that's fine. You can introduce yourself, have chat there. But if you need to ask any questions, please use the Q&A function. So I'll just share my screen and hopefully you'll be able to see my slides. No? Okay. So I'll go through the findings of the report quite quickly because I think it would be nice to get to the chat. So just a little bit of background in terms of the structure and mechanisms behind the monitoring report for those of you who might not be familiar. So each year, Correlation publishes a civil society monitoring report with a number of regular topics. So we have harm reduction essentials, hepatitis C, and new drug trends. And the reports are built on information gathered from the Correlation focal points. So each focal point has been selected by Correlation as a representative of harm reduction services within their city due to their experience, knowledge, and expertise of working within local, national, and international harm reduction contexts. During the development of the monitoring report last year, mental health was something that was emerged as something that had been overlooked in the past. And subsequently, the focal points also felt that the COVID-19 pandemic had really affected the mental health of staff within their organization. So the team of Correlation felt that this is really something that was important to look at this year. As well as this, it was clear that although there's been an increased recent focus on mental health in work settings, as you can see just on screen there, some recent guidelines from the WHO and the International Labour Organization, there's really a lack of research on harm reduction workers as a unique cohort with potentially specific challenges and needs and coping mechanisms. So we thought it was really important to focus on this year. In terms of the methodology, we chose qualitative methods for a number of reasons. Given the nature of the subject and the fact that there was very little information available, we thought it was important to be able to try and uncover as rich of an information as possible and get a deep understanding at a more personal level rather than trying to make any sort of generalizations from a quantitative data set. So here's just a map of the different cities or focal points that were involved. And moving on to the findings. So the report's findings are split into 3 areas. So we have challenges, coping mechanisms, and opportunities for organizational support. So first look at the challenges. This was also split into a number of areas. So we had challenges that related to the system, individual and interpersonal challenges, and challenges related to job satisfaction and working environment. So looking at the system-related challenges first. The interviews highlighted the profound impact of political environments and policies on both service provision and staff mental health. Particularly, a lack of funding or strict funding specifications were highlighted as very influential factors on staff mental health. And we'll see later on, this kind of trickles down and instigates or influences all of the other challenges too. Across the board, there was kind of this feeling of frustration and disillusionment towards local and national governments, and a feeling of a lack of support coming from these powers. These kind of unsupportive political environments also lead to a lack of coordination and conflict among services used by people who use drugs. And there's often challenges that arise in relation to continuum of care for service users, with clients often being rejected from services due to their substance use, and particularly within the homeless and medical sectors. This lack of alignment results in emotional distress for staff, particularly as they have to witness clients being rejected from services because of their substance use, which can also put them at risk of extreme death and illness, extreme illness and death. And I think that a lot of the time there's also kind of a sense of stigmatization coming from those other services towards the staff working in harm reduction. So just a couple of quotes as well, just to highlight the points. So just the importance of politics. If the political situation is against harm reduction, it makes the work more difficult. And just this feeling that they're not welcome in the other organizations. So there's this attempts to collaborate with organizations and really feeling like it's not possible. And again, just the wide variety of needs that people who use drugs have, and it's really difficult to actually be able to access services to address these needs. So on the individual and interpersonal level, we had a quick look at the overall staff mental health. It's quite varied. I won't go into a huge amount of detail there. The ability for staff to switch off and create a work-life balance is a major concern for service providers, because staff must develop a relationship with clients while witnessing all of this stigmatization and the systemic barriers that they face from other services and from the wider society and political environment. Alongside this, there are often cases of violence, illness, and death amongst clients. I think what emerged within this team is this balance that staff have to become very dedicated to the role, but also create this, work-life balance and trying to prevent burnout as well. So it's quite a difficult balance to get right. And there's instances of staff being available 24 hours a day or not taking breaks, really highlights kind of that struggle. As we'll see later, the relationship between a client and staff member was highlighted as one of the most important aspects for staying in roles within harm reduction, but also can be very challenging. I think particularly for early career staff, there is this kind of struggle to reconcile their invested efforts with clients with maybe the client's wishes or their ability to change. And a strong eagerness to want to help people can be seen as a positive thing, but care must be taken to ensure that unrealistic or incompatible expectations don't lead to these cases of burnout or additional stress within the roles. Kind of similarly is creating boundaries, personal boundaries with clients. The emotional nature of working with a highly stigmatized group of people who face these systemic discrimination and all of these boundaries can lead to the creation of blurred boundaries between clients and staff members. I think this is particularly true for harm reduction services because often they're the only services that are accessible to clients. And service providers might be some of the few people that clients actually interact with on a regular basis. And just examples of, clients and staff having to interact outside of services when staff are off duty. We had one focal point who noted that a client's child passed away and a couple of staff members decided to go to the funeral. So sometimes you can really see that the boundaries can be blurred and it's difficult to know where your job ends. And coping with a client's death. So unfortunately, there's quite a lot of death within the client group. And this is also challenging, coupled with the fact that busy services and high client caseloads mean that staff don't really get to deal with the death and grief properly. And often there's no specific grief counselling available for staff too. Also, just sometimes there's quite complex relationships between staff members, and it just focused really on the importance of ensuring a positive team dynamic, which we might discuss a little bit later in the panel too. So at the individual and interpersonal level, we have just a couple of quotes. So yeah, sometimes it's not about how many hours you're actually in work, but the hours that you spend thinking about work outside of work. Talking about burnout because not everyone wants to be saved, and this feeling that I gave so much, but he or she didn't want to go down that road. It's hard to cope with that at first. And then just the loss of clients, and you're losing clients that you feel like didn't have to die because they don't have the services or very harmful policies. So challenges related to job satisfaction and the work environment. I think it's not too surprising that the salary is something that came up quite a lot. Salary emerged in almost all focal points as one of the most prominent challenges in terms of job satisfaction. I think this is coupled with the demanding nature of the role, but also the cost of living crisis has really exacerbated this. And it also hinders those who may be suited to harm reduction roles from entering the field and prevents them from going in the field. And sometimes, even it's an interesting one because There were some anecdotes about staff who decided to volunteer instead of having to see services close. So we see here that even within the realm of salary, staff are choosing to continue with the service. And it's again just this kind of issue of boundaries and balance. A lack of job security is kind of a similar one. So short-term contracts and annual funding models are really common across the field. And it gives this instability, leaving workers really uncertain about their future and whether there's a future in harm reduction for them, which can really influence their mental health too. And it might influence them to move into other areas of social work. Frontline staff often have a lack of opportunities to progress within harm reduction roles, and this causes feelings of stagnation and limited growth. And overstretched resources can limit the focus on staff development, prioritizing client support over staff professional growth. And the effects of staff turnover, this can be really detrimental to a lot of services. As I said, the dissatisfaction with salary and the lack of job security mean that staff will leave and go into other areas of social work. But in particular, maintaining a well-trained staff was a huge cause of concern for focal points. A lack of funding and resources mean that training opportunities are often minimal. So if these new staff have to wait up to a year for training and then there's all this turnover, it means that the majority of staff could be not adequately trained, creating anxieties for new staff, but also putting a lot of additional pressure and strain on more senior members of staff too. So yeah, just about the pay, that we're losing experience and there's a problem of de-skilling of the sector. People aren't sure if it's a long-term job for them. Okay, so moving on to coping mechanisms. The first one is about self-care. So answers really varied in terms of self-care. It wasn't really something that focal points felt they were that aware of, or it was spoken about within their teams. It was a really, quite varied answers, physical exercise, hobbies, meditation, mindfulness, that kind of thing. And then other people said, drinking alcohol or taking drugs. But yeah, I think the difficulty in answering this question really just highlights that it's not something that's spoken about, and the focal points really felt that it was something that should be addressed. Also that there's kind of a bit of an onus on the staff members themselves to take, care of themselves and to recognize what methods of self-care work for them. So as I mentioned, the relationship between staff and clients can be challenging, but I think despite these challenges across the board, the opportunity to build a relationship with some of the most marginalized people in society and witnessing even these small positive changes within their lives was a coping mechanism and a reason that people stay within the roles. It appears as though that the challenging aspects of the relationship are more so related to the fact that they have to build a relationship with someone in these really unsupportive political environments that can be the most challenging aspect for staff. And also this kind of highlights that this passion for helping others is seen as a prerequisite for entering roles in harm reduction, and that somehow this implies that staff have to be able to cope with the difficult nature of the job and work within these low resources with very little financial compensation, that they're kind of seen as having to put up with these things. And similarly, developing a personal positive relationships with colleagues emerged. So yeah, it's just really important to have this positive team dynamic. The roles in harm reduction can be quite difficult and staff must work really close together. So there needs to be a really strong emphasis on trust within team members too. So alongside building relationships with other clients and staff members, having a sense of pride about one's work and value was seen as an important coping mechanism. So despite harm reduction kind of requiring that there's no expectations or drastic changes within clients, and the fact that there's a lot of frustration seen in the lack of cohesion between services or support from other services, I think focal points really push that there's that staff learn to celebrate even the smallest of wins within clients. I think that's a really important coping mechanism as well, to be able to really celebrate these smaller wins. And you'll just have a look at the quotes. So yeah, I think sometimes it's kind of the staff themselves don't even really know how to address these issues or maybe these early warning signs of burnout. So being able to educate yourself on those early warning signs is really important. Building relationships with these with people who are really marginalized in society. And this kind of high stakes crisis management work, it's kind of you get this familial relationship develops because you know you're obviously working together and it's pretty tough. Um, and yeah, just that the clients themselves are stigmatized, but also often the services feel that they're stigmatized too. So luckily, there were also a number of opportunities for organizational support. So for some organizations, these were already in place, and for others, these are kind of the ideal that they would like to see. So training was a huge one. So despite being noted as a crucial aspect of being able to sustain roles in harm reduction, opportunities really varied in terms of training. In general, they were common across most services, but the type and degree was kind of what varied. And induction training was most commonly mentioned. So a lot of the time it was kind of from a more senior member of staff to a new member of staff on a more informal basis. Some focal points were able to offer a more broad training package and they were very successful. But a lot of the time it just comes down to funding. In a similar kind of vein, the opportunities for team building was something that emerged as being really important. But again, a lot of the time this is dependent on funding, and the strict specifications for funding often mean that the organizations are not allowed to spend funding on team building. Those organizations that were really felt that it was really worthwhile, particularly if they were able to kind of have these events at the end of the year to look back on all of the hard work that the staff had done, and yeah, kind of this sense of camaraderie there as well. So I think it's really important. Counteracting the effects of feeling isolated from other services, focal points found that staff being part of a professional network really helped and played a key role in their job satisfaction. I think creating a relationship with national and international colleagues mitigates the effects of stigmatization and the difficulties that they might face with other services. And oftentimes this was described as a specific area of improvement rather than something that was ongoing. I think particularly in the context of frontline staff as well, because you know some of the management might be involved in these international networks, but for kind of frontline staff members are usually excluded from that. Often there was no specific options for individuals to attend free or subsidized personal therapy sessions. And given the nature of the work and the close proximity to violence, illness, and death, I think it would be expected that there would be um, people would need to seek psychological support at some point in their careers. So again, issues in funding here just mean that this isn't often possible. And in particular, as I mentioned, with the difficulties with client death, a lack of grief counselling was evident across the board as well. So mechanisms for feedback and support really varied. I think most focal points were definitely able to offer some sort of supervision or intervision, whether that be on a weekly, monthly, or more of an ad hoc basis, which is great. But the interviews made clear that there is really a need for very structured mechanisms for supervision and feedback. A lot of the time, I think these sessions often focus on the clients, and there's not really much time to reflect back on how the work might be affecting their mental health. So I think that would be an area of improvement for some focal points or some services. And lastly, creating an inviting physical space. I think that oftentimes the space can be quite uninviting, and staff felt that if there was a more welcoming space, it would actually help with the relationship between staff and clients, and also that there's not really any place for staff to take breaks and then maybe be able to interact with and create relationships with each other. So that was something that was seen as well as important. So yeah, so sometimes there's not enough budget for team building, something for training. Yeah, again, this is just to do with team building. So again, the government's specifications mean that it's not allowed to be spent on that. Yeah, becoming part of this national community, the European community helps mental health because you can say to someone, you are not alone, you are not experiencing this stress, this frustration, this experience by yourself. And yeah, again, just to humanize the space and feel that, you know, you can have a bit of pride about the space too. I think I'll just go quickly through the conclusions just because we're a bit short on time. But again, just looking at these barriers that staff face, trying to create these boundaries with clients, and then balancing this passion and resilience with burnout prevention, and then the importance of these relationships between staff and clients, between team members, with other external services, and with national and international colleagues. We do have a number of recommendations. I don't think I'll go into them in a whole lot of detail. They're all detailed in the report. But just for policymakers, a lot of the time around funding and funding specifications, and to really just include services within, the creation of these funding specifications and plans. For organizations, for organizations specifically, we have an intern in correlation at the moment working on more specific guidelines for organizations. So that'll be quite exciting. It should be developed by the end of the year at the European Harm Reduction Conference. I think we will launch them. So I think maybe my colleague might be able to put a link to that in the chat. And I think we can talk about this a little bit more in the panel discussion about, how we can actually use this information from the report to create some practical guidelines. And then just also for staff themselves, this kind of collective responsibility on them to, ensure that they have a work-life balance, they're setting these boundaries, that they're using these self-care methods. So that is it in terms of the report. I hope it gave you a little bit of insight into it, but again, you should have a copy of it if you need to read through. I'm going to go to the panel discussion now. So let me introduce my lovely panelists. So first of all, we have Tessa Vindelik. She's from Free Clinic in Belgium, in Brussels. Sorry, Antwerp. We have Magdalena Bartnik. So she's from Precursor Foundation, and that's in Warsaw in Poland. And then we have Martin Blakeborough. So he's in Kaleidoscope, which is in Newport in Wales. Thank you very much, all of you, for coming. I think we might start off. So I spoke quite a lot about the challenges. So I'd be interested if you could kind of maybe talk about how or which challenges most affect your service. So maybe starting off with Magda.
Yeah, thanks a lot. I would start to point out that harm reduction is on the outskirts of treatment system and more generally aid system. So we are operating not really within the mainstream and all the services, and it makes so this position being outside is one of the biggest challenges for us. And the consequences is that it was already then mentioned by in the report that there is a huge reluctance toward harm reduction workers from medical community and therapeutical community, even social workers, not really understanding the paradigm or the harm reduction in general. That's not just limited to HIV prevention, but it's much broader. So I would say that's the biggest thing. We are not really being valued, besides not being funded, and it is under-resourced. And the second thing, and it was also mentioned, which is also one of the biggest challenges, is facing this very difficult moments, death of our clients, or the violence they go through, and many different issues, homelessness, and the sense of rejection from many different services and facilities. So I'd say these are the two major issues that are the biggest challenges for our work.
And maybe moving on to Martin, maybe it's a slightly different context over in Wales, but maybe, I don't know, you face similar.
Yeah, I mean, I think there's always overlapping issues, but I do think that colleagues in, well, I remember when we did the panel, from I think North Macedonia, and the resources they have for harm reduction services, and also then, in terms of Magdalena, the resources they have in Poland, for providing services are much less. I always feel a little bit guilty But I think some of the issues do overlap. I mean, if you're looking at low pay, I mean, the cost of living, my workforce, we're not being able to keep up with the you know, with salaries equaling what cost of living is. So our staff effectively every year are having a pay cut, but you know, but by default. I think also that when you look at illogicality of drug policy, I saw in the chat, you know, about illogicality of drug policy. Basically, it's really difficult when you're trying to set up healthier services that make total sense. For example, giving a safe space for someone to inject drugs who is homeless. It's very difficult for staff and workers to get their head around that. The governments are stopping you doing that. It just doesn't seem to make sense to your job. I think the other challenge, which I think is actually a positive challenge, is the issue of employing people with living experience as well as lived experience. It's a really good opportunity because people, the staff we're employing with such experience are more aligned with the client group we're supporting. But I think in the chat, they also shows they often have more stress because they're closer to the client group. So someone dies in that community, it's often a friend. And also, I think if we take the view that 85% of people with drug problems have had significant childhood trauma, so a lot of our staff now are living with significant trauma, that also changes the support that agencies like us need to give to our staff. So I think it's a challenge, but it's a challenge of our own making in a positive way. So yeah. Just a few comments from me.
Yeah, I think that's a really important and interesting point that we didn't really get to go into enough any detail really in the report, is about the people with lived and living experience. And I think it would be important to look at what kind of additional supports they might need as well. It's really, yeah, important. Moving on to Tessa.
Hi. Well, one of the biggest challenges from the past years, I guess, is that we see that there are a lot of differences between what the people we work with want, what the team wants, what the team leader wants, and what policymakers want. And we have to try to get that into balance, I think. And one of the personal organization challenge, I guess, it's a very different team we work in. We have people with life experience, we have people with lived experience, social workers, nurses, doctors. It's a really broad, multidisciplinary team. And I think we have to also differentiate the support and coaching we give to those different disciplines, I think. And maybe one of the challenges is also, are the team leaders experienced enough in coaching? I think it's not because you're a senior worker that you are able to coach all those different disciplines. So this is something I think we have to look into.
Okay. So even for the management, that there's this need for increased training and how to deal with, yeah. Okay. And I know that you spoke about that before. So how would you as a manager try to ensure that there's cohesion between the team? Like what kind of supports would you like to see available to ensure that?
Well, for me, it's about creating a safe space. You have to have the safety to talk about different topics. And that's not always the case. Or it's difficult to reach that because sometimes people are afraid to talk about having problems, personal problems, or maybe sometimes we see that people relapse if we work with colleagues with life or lived experience. And it shouldn't be the case because I think it's normal to talk about things, but they may not be afraid, they cannot be afraid to lose their job. So we have to guarantee that safety at least, because otherwise we can't talk about it in an open space.
Yeah, absolutely. And maybe, Martin, in Kaleidoscope, what kind of supports do you have? I mean, certain things like salary, maybe you can't change, but what can you bring in to help with staff's mental health?
I mean, I think one of the things we've really tried to, and that's probably because we're probably better funded than some other agencies, is we've taken on the challenge of what's called Investors in People, which is an independent sort of assessor of how you treat your workforce, and that's across the UK. And we've managed to get the top mark for that, and that's by putting in systems of support for staff, making sure that, I mean, we employ about 270 people across Wales. So although I'm speaking on, from Newport effectively, we have systems across. So supervision is really, really important. I mean, you have to make sure. I mean, I think Rui says, how do you support people with, I think it's a living experience, and quickly touched on it. But that is actually about making sure that you are constantly supporting people, enabling them to put boundaries, because that's really important. If you've not used to put boundaries, that's about protecting a member of staff. It's about making sure that you're talking about their well-being constantly. So we have 5 ways to well-being, which is in every supervision, which we're saying, how are you connecting, maybe with your family? How are you keeping active? So are you taking part in the UK? I'm obsessed by parkrun, but, it doesn't have to be running. It could be, reading, but just making sure, making sure you're keeping yourself going for a walk or whatever, that you're looking outside yourself. So you're taking notice of that around you. You have an emphasis on learning. We all need to keep learning. So you're trying to stimulate people into what have you done in learning. And also in your personal life, how are you giving back to people in your own social circles? So not in work, but in your own social circles. I think it's really about putting the most important thing for a worker is saying to them, you've got to look after your own mental well-being, because if you don't do that, you won't be able to help anyone else with their mental well-being. And I think also creating flexibility, flexible working. Certainly, it isn't just, although it's important that people who've got kids are supported, but people with older parents, people who've got mental health issues, we brought in a thing called a U Day. So again, with the idea of a U Day is you focus on yourself. You don't go into work that day, but you do something that's really positive. So I suppose little things like that, you try and do in compensation the fact that what I can't do is pay people probably what they're worth, but create a really positive work environment for people, and also the space of service users or people with problematic drug use, as well as our staff can go. So it's a positive environment, a positive place to work in.
Yeah, I think sometimes it's good to focus on the things that we can change. A lot of the time salary is dependent on the government, and, organizations can't change it, but being able to make those small changes, maybe in the physical space and things like that, really do have an impact on staff mental health, which is great. And Magda, moving on to you. So you mentioned about, the difficulty with dealing with client death. What kind of supports do you have available, or would you like to see available in that instance?
Yeah, I would say the space for open and honest talk within the teams is is really important. Also to have doubts, ask questions, maybe questions that already were asked before, and also to empower each other within these groups and teams. And also, the matter of the issue of, believing in your work, believing that or you're asking a question, what is success or what is effective? So understanding and believing the sense of work and your duties there. I would say that we've been trying to do this for years now, is to look for allies. Also in, services and areas and people working with marginalized populations, because the reluctance towards harm reduction services is so huge and common in the treatment system and more generally. But you really can find organizations and people that want to unite, in order to not necessarily work together, but to broader this the space where you can really talk about what is help, what is support, and what that really means. And for example, we do work with organizations who help homeless people, and as far as people who use drugs are concerned, they are really excluded from many homeless services, like homeless shelters, but not just shelters in general. So it has been changing slowly to really include various groups, and think about common objectives we have, even with communities that at the beginning weren't really agreeing with the paradigm actually, but to open this and to have this feeling that you are not alone while you're working harm reduction, and you can really connect with different communities and services and people.
Yeah, I think it's really important. I wonder, Tessa or Martin, do either of you have a similar or different experience of interacting with other services? Maybe it's more positive in either of your cities, or?
Well, we have in Antwerp, we have a very good cooperation with the drug pastoraat. Yeah, I don't know the English word for it, so it's people who voluntarily support our client group and also do services when people die, and it's not related to religion or something. So it's open for everybody, and they do a service special for our client group or people who die on the street. And everybody has the opportunity to say something. So it's not that orchestrated, so people can come up front and say something about their friend that has died. So I think that is very important for the people we work with, and for staff members also to visit that meeting or remembrance moment. And maybe I have to say we come from a long way, because when I started in harm reduction, then you had to be tough. If you work in harm reduction, you have to cope with people dying, people going bad, and stuff like that. And I think we have to move to something else. We don't have to be tough. We can talk about it, and we can find it difficult to see people go or see people going bad. We don't have to be tough. I think that is a good evolution we are going through, and I think we need to evolve more to that.
But one thing we've done at Glasgow, we've sort of reinstated it, is a Remembrance Day. So and it isn't what we're trying to. We still keep Overdose Awareness Day. We're still aware of World AIDS Day, and obviously they're often in relation to death. But a lot of our clients don't actually die of drug overdose; they just die. I mean, it might be related to health issues that their drug use has given them. So so the simple idea is, again, it doesn't have to be religious. It is just a time where people have a remembrance book. There's a couple of candles so people can just quietly reflect if they want, and there's a together like 11 o'clock, a bit like when you remember those who died on Remembrance Day, in wartime. So I think it's trying to create space, because a lot of our service users, they still can't go to funerals. I mean, because of the stigma that they have, is that the family don't really want to, if they have family, they don't really want to be reminded that the death was caused, or my family member hung around with these people that society looks down. So I think things like that. I think for staff, I mean, we're really lucky that we can afford to be in this private healthcare system called Simply Health. And that allows us to offer all staff independent counselling, because it's fine being counselled by another member of staff or by a manager, but someone who is totally separate I think sometimes really helps. Again, I look at correlation. I know that Tessa and I talked about, trying to get a network. So, it might actually be possible that, for agencies that maybe can't afford that sort of healthcare, that we can provide workers in our own employment that maybe could talk to someone from Poland, and only because then there's no relationship to the management issue, or, things like that.
Yeah, I think sometimes, this lack of funding, we need to come up with creative ways to use the network as a resource.
Yeah.
And yeah, I think sometimes, staff have to use their own manager as kind of a counselor, which can cause its own issues. So I think it's a really nice opportunity to maybe lean on each other a little bit too. That might lead me on to kind of, what do you see as the next steps? We've created this report, but what would you like to see? How would you like to see it used? How can we use it to advocate for the mental health of staff? Can you think of maybe any practical ways or changes that you would like to see?
Well, no one's talking. I mean, I think, as I say, I think the network being supportive of other organisations could be really, really helpful. I think actually the acknowledgement that there is mental health issues in our staff. So I think in my time, and I've been at Glasgow for 30 years, it's a long time. I think the original culture was we were there to help people who were coming into our services. And I think what I really welcome about this report, and I think it's probably one of the first of its kind, is actually saying we need to be kinder to our own staff. And we need to be recognising not just their practical difficulties like childcare, which is important, but also issues such as their mental well-being. And actually a lot of our staff, because if you're in the social care industry, what motivates you to be in this industry or in this vocation? It's often that you yourself have had some sort of suffering. So you want to help other people who've gone through maybe similar experiences. So inevitably, we're probably going to have more mental health issues than others. So I think acknowledging it is probably the most important.
Yeah, absolutely.
Yeah, and I want to second that, Martin. And as we talked about in Budapest, maybe we can start with just a network with online or exchange phone numbers. But because sometimes people are still afraid to talk about some things in their own organization, and I think we should give people the opportunity to at least talk to some peer or somebody who you met online or in person in a conference, and or maybe a group, and we can think about how to manage the situation, or maybe open possibilities to the own organization. And I think the report has to be mandatory reading for every director and staff member in harm reduction services. So I looking forward to the second report you are going to do, and maybe also create a training for how to coach people thinking out loud. Yeah.
And do you think it can be used as a tool for maybe more like the policy level, or how do you see that?
I think we first have to work bottom up.
Okay.
Yeah. My opinion is first start with the organizations that they are willing to create support and coaching and time for staff. And second is, of course, look for funding. But if we have to wait for funding, we are maybe 2-3 years further or never get funding. So be creative.
I suppose though, Tessa, I would say that I partly agree with you, partly don't, because I'm sort of going that, again, it is a divide between those countries that pay better and those countries that don't pay better. But if you're looking at the countries that pay better, we're getting squeezed on things like they're saying we can only pay for the direct work you're doing. Well, that's part of, then you have to talk to the commissioners and you have to talk to government about, if you want our workforce to be effective, then they're going to have proper training and support and development. And I think in the UK, it hasn't worked because we used to have this thing called DANOS, which was about training drug workers in the workforce and alcohol workers. But I think part of it was our fault as well in the sector, that we needed to push harder on it. And I think as agencies with governments who want to do something about drug use, I think there is an ability for us to stand up and say, if you want us to be the best we can, which is what you want because you don't want all these problematic drug users, then we need to have the training. So I agree, we have to look at ourselves, definitely. Yeah. But we also do need to be lobbying government for change.
Of course, but you need to power up and connect with the other organizations. So we need first to involve and advocate in organizations that it is important to create time and money, and then go to advocate, of course.
Yeah, I would say that, you know, this issue, mental health among service providers, it should have been always there, and it wasn't. It has to be there. It has to be a part, you know, of planning projects. And I would say that, you know, in grants and applications where you can gain funding, there should be a point saying that staff has to be taken care of and has to be supported. And, you know, that we should never have to choose between helping clients or helping, you know, supporting the teams. That should not happen, because otherwise then you have situations where, you know, you are trying to do your best, but then there's burnout and you can't really work more. So this issue has to be also it has to be also included in these programs, these national programs, exactly like with peer work, but you know, supporting and having funding, a specific funding for all activities around, you know, keeping staff members healthy, right, and supported. So I would say that on these national legislations level and programs, it should be there. We need to have this, you know, we have to take care of people. It's not a matter of choice. So I would say that would be the next step. We, in consultations of programs, also on a municipality level. Yeah. And you know what Tessa said, that people had to be hard. And it's very often, you know, people from harm reduction are, you know, perceived as warriors with no weaknesses. And, you know, those who have to constantly work to reduce harms related to drug use, but even more very often reduce harms related to drug laws and discriminations among, you know, within the systems. So you know, I would say that we don't have to be strong, that strong. We can be weak, and that's fine. That's exactly what's the nature of work and human nature.
Yeah, absolutely. You can't be that strong. It's not possible. So I think we need to remember that. We might move across to the Q&A. So if anyone has any questions, just make sure to put them into the Q&A section. I think we have kind of two questions that are a little bit similar, but how to keep the staff motivation when the official policy is treating harm reduction as a secondary issue. I think there's a similar question about kind of separating the staff from those difficult political environments. How can you kind of encourage them to stay motivated within that context?
I mean, the political one's difficult because different staff have different outlooks. So I know sometimes staff wonder why I'm banging on about drug consumptions and not banging on about whatever the subject is that they feel most passionate about. Maybe you know, it's more about the practical thing of making sure that we have a better environment and invest more money into that environment. So I guess sometimes that there is competing ideas amongst staff, but I think it's important that you continually campaign for change as an organisation, and that they can see that there is a campaign for change, because anyone working in this field really cannot be happy with what's happening. I mean, we can't be happy with the amount of people dying from drug use. I mean, in the UK, it's particularly acute. I mean, we've got some of the worst figures. No one could be happy about people who take drugs ending up in prison, and it's extremely expensive and counterproductive. So I think where we can is trying to work with our staff and our service users to campaign for real and long-lasting change. But it seems an incredibly difficult battle, particularly I think colleague from the Netherlands points out, with popularism and in a way the right wing a bit on a march. It's never very good for our sector. Yeah. Although good news in Poland.
Yeah.
Yeah. Well, I'm not sure if I'm the right person to say something about it, because I'm not working in a very hostile environment in Belgium. But I think it's really important to say to everybody who's working in harm reduction, we are making a difference, and we can make a difference. We save lives. So keep repeating it, and if you believe in harm reduction, and I know you all believe in harm reduction, for me, and I said it in the report also, for me, working in harm reduction is my burnout prevention. But you have to start with the right mindset. And sometimes we forget it. So we have to remind each other that we are making a big difference in working in harm reduction.
Yes, and to always, among teams or with colleagues, to remind ourselves constantly what is, the essence of it, really. Because sometimes, when people are overwhelmed and there's huge stress, they really, lose the track, meaning they see nothing or not much is changing, and people still are, in these dire conditions. And these small changes, they really count. So really to motivate people by, acknowledging constantly their work and saying, this is, like a light in a tunnel. This is keeping life. So it's a very, it relates to this, how you see the world in general. What is possible? What can you change? So if you can help one person, this is a huge change you can make, even if these are just small steps. And in Poland, because the treatment system, which is really difficult to change, meaning that there's abstinence-based treatment system, and it's really difficult to get through with this idea of harm reduction and not having abstinence as the aim. I would say that, because it's abstinence-based, everyone wants to be addiction treatment therapists, and not many want to be harm reduction workers. But it's connected with, understanding harm reduction, the paradigm, that it's much broader than just the services themselves. So changing the narrative around drug use, or talking about root causes of dependencies is also important. Not to be isolated in this harm reduction communities and organizations, and being treated as being against the aims that the system has, but to really change how we perceive drug use and dependencies. That this is not just about addiction treatment. It's much broader, to show that it could be an umbrella idea, that harm reduction starts not just in services. It can be implemented and practiced everywhere in different services and institutions.
I think that would allow the staff, working in harm reduction, to feel more part of the bigger picture. I think that would be really, helpful for their mental health too. I don't know if there's any other questions, maybe. related to mental health.
I think there was a comment by Marta, which has picked up a bit of interest, where it's not totally related, but I created a group of social workers to have case discussions and share articles and book group reading support in between. I thought that was a good practice. I don't necessarily do that in all centres, but I think actually, if you're looking even about politicalisation, it's actually looking at what's coming up in the news and how's that affect us, and where is inspiring reading. Not always related to drugs. Sometimes it could be a TV program, but I guess I don't know if we Equalise Group do enough of that group sort of stuff with staff. I think that's probably something we should look at doing.
Yeah.
I don't know if other people have got in the panel also looking at that.
Yeah, I think this kind of knowledge sharing is really important.
Yeah.
And there's a good opportunity there. I don't know if you have any final points from the panelists. No. I think yeah, one thing I guess people ask me, what are the differences between the cities that emerged through the interviews and what are the similarities? And I think the number one was just that all of the focal points were really happy that we were focusing on this topic, and really felt that it was something that has not really been focused on in the past. So I think we can use this as more of an exciting opportunity to really be a turning point and really focus on staff mental health, and use the network, as you said, and use these different opportunities to work together. So I think it can be a little bit doom and gloom sometimes, but I think it's definitely an exciting opportunity too, which is great.
Yeah,
so.
Together we're stronger. They're definitely learning both from those who maybe, like in Portugal, where they've got very different policy, which is really inspiring and it's been helpful to us in Wales, but also learning from countries where it's not so easy. For example, in because it makes you go, actually we are working in a slightly better environment, so I should be grateful for that. But also, I think sometimes when you're up against it, you have to be more creative. And that creativity that, say, like Magdalena shares with us, we can still benefit that in services that we. So I think it's good having that correlation.
Yeah, absolutely. Okay, well, I'd like to say a big thank you to my panelists. It was a really nice discussion. If anyone has any further questions, I think we can pop my email address into the chat. Maybe I can even pass that on to the panelists if you had more specific questions for them. And thank you to everyone who also contributed to the report. You should have a copy as well, a link in the chat there if you want to read more, but we'll be sharing it on our social medias as well and on our website. And also this webinar has been recorded, so it'll be also posted up on our LinkedIn and our website too. Thank you so much, everyone, for
Thank you.
attending today.
Thanks.
Thank you.
Thanks. Bye.
Thank you.
Thank you.